Welcome to STI's presentation on the Advancing Care Information category of MIPS. This webinar will provide a general overview of the quality payment program, as well as provide you with detailed information regarding the required measures of the Advancing Care Information Performance category, scoring, and data submission options. Some key points regarding MACRA. MACRA stands for Medicare Access and Chip Reauthorization Act. This law was signed on April 16th of 2015. It repeals the sustainable growth rate methodology. It has created a unified framework known as the quality payment programs, and there's two tracks, MIPS and APM. It has combined our existing quality reporting programs into one new system. The existing quality programs are sunsetting at the end of 2016. That would be PQRS, Medicare's Meaningful Use EHR Incentive Program, and the Value-Based Modifier Program. I would like to note that Medicaid EHR Incentive Program will continue beyond 2016. There's still incentive money available to under that program. So we do want to encourage our clients to continue with their participation throughout 2016 for PQRS, the Value-Based Modifier, and Medicare's Meaningful Use Program, so you would avoid any penalty under these programs in 2018. There are two tracks, MIPS, which stands for the Merit-Based Incentive Payment System, and the second track is APM, or Alternative Payment Models. Now, MIPS is made up of 4 performance categories: quality, advancing care information, clinical practice improvement activities, and resource use. In 2017, advanced APMs have been identified as Comprehensive End-Stage Renal Disease Care Model, the Medicare Shared Savings Program, Next Generation ACO, Comprehensive Primary Care Plus, and the Oncology Care Model. Advanced APM must meet the following criteria. Participants must use certified EHR technology. The APM bases payment on quality measures that are comparable to those in the MIPS quality performance category. And the APM either bears more than nominal financial risk for monetary losses or is a medical home model expanded under CMMI authority. I do want to note that MACRA does not change how any particular APM functions or rewards value, but instead it creates extra incentives for APM participation. CMS does predict that within the first year of MIPS, which is 2017, most clinicians will fall under the MIPS track. Medicare Part B eligible clinicians will consist of MDs, DOs, dentists, dental surgeons, podiatrists, optometrists, chiropractors, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists. The Secretary may broaden the group by 2019 to include physical and occupational therapists, speech-language pathologists, audiologists, nurse midwives, clinical social workers, clinical psychologists, dietitians, and other nutritional professionals. Now, this list of professionals may voluntarily report on MIPS measures and activities, but they would not be subject to the MIPS payment adjustments, which would begin in 2019. There are three groups of eligible clinicians who will not be subject to MIPS, and that is if it is your first year of Medicare participation. So those newly enrolled clinicians in Medicare would not be would be excluded from MIPS their first year. Second is if you are participating in an APM and you qualify for the bonus payment, you would be excluded from MIPS. And third are those eligible clinicians who fall below the low volume threshold, which is defined as Medicare Part B billing charges less than or equal to $30,000, or you provide care for 100 or fewer Medicare patients in 1 year. Now, MIPS does not apply towards your hospital or facility charges. Each eligible clinician will receive a composite score, and for 2017, your composite score will be made up of the three performance categories. 60% of your score is coming from the quality performance category. Advancing care information will make up 25% of your score, and the clinical practice improvement activities will make up 15% of the clinician's composite score for 2017. Now, the resource use category will not be factored into your composite score in 2017. However, starting in 2018, the resource use performance category of MIPS will count for 10% of the clinician's composite score, and it will increase to 30% by the year 2019. The clinician's composite score will be compared to the MIPS threshold, which has been set at 3 points for 2017. So clinicians whose score are 3 points and above would receive a positive payment adjustment, neutral to positive payment adjustment, and it is based on a linear scale. Clinicians who receive 3 points or below, again, would receive a neutral to a downward payment adjustment. And again, your payment adjustments under MIPS will begin January 1st of 2019. So for the first payment year of MIPS, which begins in 2019, you are looking at either a positive or negative 4%. And the percentage rates do increase as we move along in the years of MIPS. Budget neutrality only impacts those clinicians receiving a positive payment adjustment. And the formula is 3 times the year's percentage rate. Budget neutrality works by taking the money that was not paid out to the clinicians receiving the negative payment adjustments and redistributing it to those receiving a positive payment adjustment. So, for example, within the first year of MIPS, clinicians receiving a positive payment adjustment could actually receive up to 12% based off of the budget neutrality factor. There is a separate payment adjustment for those clinicians who perform exceptionally well in MIPS. There is a separate bucket of money. $500 million will be available each year from 2019 until 2024. A clinician could receive up to an additional 10%. Clinicians who receive a final score of 70 points or higher would be eligible for this additional bonus payment. For 2017, clinicians have the choice to pick your performance period, and you have 3 options. The first option is to test the quality payment program. You must submit at least 90 days worth of data on either one quality measure or one clinical practice improvement activity or the base score measures in the advancing care information performance category. This would prevent you from receiving a negative payment adjustment. The second option is that you would participate for part of the calendar year. You would report on all activities and measures in the 3 performance categories. Again, they are quality, advancing care information, and the clinical practice improvement activities for at least a minimum of 90 days, but you would not have to report on a full calendar year. And the third option is that you are reporting on all activities and measures for the full calendar year. Now, the second and third option will certainly yield you a positive payment adjustment based off of how well you perform. You can report as an individual or as a group. The individual will be identified using the combination of their billing TIN and MPI numbers. And a group, which is 2 or more eligible clinicians, are identified by their MPI who have reassigned their billing rights to a single TIN. It is important to note that you must use the same identifier for all of the performance categories of MIPS. There are several submission options to choose from, whether or not you are reporting as an individual or as a group. Now, for larger groups, which are 25 or more eligible clinicians who choose to use the CMS Web Interface, you must register as a group by June 30th of 2017. Keynote is that you may only use one submission mechanism per category. Here's a timeline of events, most of which we've mentioned already in the webinar. But I do want to point out that in July of 2017, eligible clinicians will receive their first MIPS performance feedback report. This is replacing the QRUR, and it will reflect the quality measures as well as the cost measures in the resource use category. You will receive your second report in July of 2018. And again, just to clarify, CMS is collecting the data on those cost measures in the resource use category. However, it will not be factored into your composite score. Advancing care information is replacing the current Medicare's Meaningful Use program. This MIPS category does count for 25% of the clinician's composite score. Now, some key changes from our Meaningful Use program to the Advancing Care is that they have dropped the all or nothing threshold for measurements. It has removed the redundant measures to alleviate the reporting burden. We no longer have to report on the clinical provider order entry or the clinical decision support objectives, and it has reduced the number of required public health registries to which a clinician must report. So this performance category is made up of a base score, which you would achieve 50 points for. If you choose to get additional points, you can choose measures under the performance score, and there are bonus points available for public health registry reporting, as well as the clinical practice improvement activities. All total, Any clinician receiving 100 points or more, and you would be capped at 100 points, would receive the full 25% of your composite score. So the base score consists of 4 measures, and you must complete all 4 measures in order to achieve the 50 points. Now, you must attest yes to protect patient health information. This is where you conduct a security risk analysis and implement security updates as necessary, and correct identified deficiencies if necessary during your reporting period. It's paramount that you do this and report yes to this measure. Failure to report yes to this measure, you would not receive any points under the advancing care information. Next is electronic prescribing. Now, you must at least one permissible prescription written by the clinician is queried for the drug formulary and is transmitted electronically using your EHR technology. All you need to do is to report 1 in the numerator of this measure. Next is provide patient access, which is at least 1 patient seen by the clinician during the performance period is provided timely access to view online, download, or transmit to a third party their health information. And the 4th measure is health information exchange. The clinician that transitions or refers a patient to another setting of care or healthcare clinician would use their EHR technology to create the summary of care and then send it electronically. Again, you do not have to meet any threshold for those 3 measures. You simply have to have 1 in the numerator, answer yes to the protect patient health information in order to achieve the 50 points in the base score. Now, for clinicians who want to obtain additional points to really beef up their score, you can pick and choose the measures that best fit your practice. And again, there's no threshold, but you do want to have a very good numerator compared to the denominator to get you the most points. So health information exchange, I just reviewed, that is one of those base score measures. You can obtain up to 20% additional points. Next is immunization registry reporting. This is where the eligible clinician is in an active engagement with a public health agency to submit immunization data. Next measure is patient-specific education. The clinician must use clinically relevant information from their certified EHR to identify patient educational resources and provide electronic access to those materials to at least 1 patient during the performance period. Next is another measure that we identified under the base score of this performance category, and that is provide patient access. Next is secure messaging, which for at least 1 unique patient seen by the clinician during the performance period, a secure message was sent using electronic messaging functioning to the patient, or in response to a secure message sent by the patient. The last measure is view, download, and transmit. So at least 1 patient seen by the clinician during the reporting period views, downloads, or transmits their health information to a third party. So again, you can pick and choose these measures that best fit your practice, and there are no thresholds You just want to try your very best to obtain the best possible score. You can receive up to 5% bonus points if you are in an active engagement with a public health registry, and an additional 10% bonus points for completing one of the clinical practice improvement activities. And there's about 18 of those practice activities that would yield you this bonus point. And here's an example of one of the practice activities. As you can see, there are several functionalities of EHR that really kind of support the practice activity, which is provide patient access, secure messaging, sending and receiving care summaries. That functionality really does support the practice activity that is providing 24/7 access to eligible clinicians or groups who have real-time access to the patient's medical record. And so again, by performing this practice activity, you would receive that 10% bonus under the Advancing Care Information category. Submitting your objectives for both individual and group reporting, your choices are either through attestation, a QCDR, a qualified registry, or EHR. Now, for group reporting, there's one additional submission mechanism, and that would be for the larger groups of 25 or more clinicians. They could choose the CMS Web Interface. But again, there is a registration deadline if you do choose this option. CMS has provided us with the Quality Payment Program website. Go to qpp.cms.gov. There you will find numerous documents and fact sheets regarding the quality payment programs, and they also supply us with the measures under each performance category. If you select Explore Measures and go to the Advancing Care Information tab, you will note that there are two tabs. This depends on your EHR certification, your ONC certification. So for the chart maker clients, you would want to select the 2017 Advancing Care Information Transition Objectives and Measures. By selecting on the measure name itself, it will give you a drop-down window that will give you a full description of the measure. Again, just very important to note, you will see these two tabs. You want to select on the correct tab based off of the ONC certification for clinical. We're currently in the comment period of the final rule. You can submit your comments or concerns regarding the final rule up to December 19th. You can submit that electronically or through mail, and I would like to remind everyone that your comments are made public. So you want to be mindful as to the type of information you share within your comment. And here's just a list of dates for our upcoming MIPS webinars. We will be next looking at the clinical practice improvement activities of MIPS, and then ending out the year with the resource use performance category. This concludes our webinar for today. Thank you.